Good day to everyone who is listening to this pre recorded lecture. Welcome back. Hello, hello. It's time for learning once again. So, our topic for this day or for this video, we are going to talk about phlebotomy, and specifically, we have here two topics: proper patient ID or identification, and we will also tackle skin puncture. Okay, so this PowerPoint is prepared by Sir Leo Cinco, and basically, guys, for this topic, we are going to talk about, proper ways on how to correctly identify your patient so that the results you will give to that patient will be accurate and precise. Okay, so that for the welfare of your patient, and also to keep your licenses, when you become registered medical technologists. Okay, so yeah, this is one way to keep your licenses from getting revoked or maybe canceled. Now, for skin puncture, this is one of I think the basics of phlebotomy. It's really easy to do, easy to manipulate. So we're going to talk about its advantages, disadvantages, how to perform skin puncture. And in our classroom, I will send there a link of a separate video I made that was all about just a quick recall of the steps of skin puncture. Okay, so yeah, I hope my dogs are barking outside. I hope it doesn't get caught up with the mic, but if they do, I'm very sorry for that. And let's start this video. So first, guys, before we delve in, we must know the characteristics of a person's blood. So we have here, it is in fluid form, of course, due to the naturally circulating anticoagulants, or it keeps it from clotting. But in vitro, guys, it coagulates within 5 to 10 minutes only, okay? Now, of course, the color of blood is red. We all know that. Siguro nasamad na ta, or maybe, we experience getting wounded. So, yes, that's the color of our blood. It's red due to your hemoglobin. Okay, so it has a pH average of 7.35 to 7.45. It is also thick and viscous, okay, as it's 3.5 to 4.5 times thicker than water. That's why we have the saying blood is thicker than water. Well, we can also say, um, what do you call this? Scientifically speaking, 3.5 to 4.5 blood is thicker than water. Okay, so please remember that. And then, on average, an adult male has 5 to 6 liters of blood, while adult females have 4 to 5 liters of blood. Okay, now males have a lot more blood in them because males have increased body mass. Okay, now next, let me show you a picture. This is a drop of blood. Okay, so basically, for the color red, it has two types siguro. I think you have encountered this: the oxygenated and the deoxygenated blood. So the oxygenated blood, meaning it still has oxygen, so its color is bright red. Whereas deoxygenated blood, this is what we usually um, get from our patients, it has a deeper red purple color. Okay, so please take note of that. Now, next up, the question is, what are the components of your blood? Okay, so it's not only limited to like having it like a water consistency, it has certain compounds and cells in it. So we have here the liquid portion. So, guys, take note, the liquid portion of blood, it has, what do you call this? It basically has two phases, siguro, na Wong. So, first we have plasma, and then we have serum. So, basically, guys, they are the same, but the only difference is that serum, it is the liquid portion of the clotted blood. Okay, so what do you call this? Nagkubol. I don't know how to. I forgot the term. Basta nag na-activate na ang blood. Okay, dili na siya fluid form. Kato na siyang mura siyang ni harden. Okay. So it is the liquid portion of the clotted blood without the fibrinogen, whereas the plasma is the liquid portion of the unclotted blood. Now, what I usually do is unclotted blood and plasma. So I usually have the mnemonic UP. I don't know, maybe it will help. Unclotted plasma. Okay? Now, next, we also have a solid portion of our blood, which we discussed in our previous lessons. We have our red blood cells, white blood cells, and our platelets. And then the last one, we have the gaseous portion. So this involves an exchange between your oxygen and your carbon dioxide. Now, let's take a look at this picture. So this is your unclotted blood. Okay. First picture here, this is the unclotted blood. So it has the plasma. Okay. Plasma ang iyahang liquid form. Whereas clotted blood, serum siya. Okay. Because fibrinogen is what helps the blood to clot. Okay. So diri, wala pa siya na clot. So, the fibrinogen is not used. So, pag spin ana sa, what do you call this? Centrifuge, there will be like a series of events that will take place na ma-activate ang fibrinogen. So, ang mahitabo, maklot na tong blood. Dili na siya katong murag liquid or viscous form. Magtikubol na siya diri. So, na-used up man ang fibrinogen because na-clot man siya. So, meaning, ang kanisya na portion nato diri, wala na siya fibrinogen. Okay? So, I hope that makes sense. Okay, now next, let's review our peripheral blood. We have here our erythrocyte or your RBCs. We have five WBCs, namely neutrophils, basophils, monocyte, eosinophil, lymphocyte. And lastly, we have our platelets. So take note, there are types of WBCs. We have our granular and your agranular. Okay? Granu granular, granular, kamo, and agranular. Okay. So, ala, nawala. So number one is the granular. What makes up the granular? We have our neutrophils, your eosinophils, and then your basophils. Whereas number two, for your agranular, we have only our monocytes and lymphocytes. Okay, ML, Mobile Legends. So, okay, that's it. Two types of WBCs, granular and agranular. Next, we we have your preparation of blood sample. So one of three different specimens may be used. We can use our whole blood, your serum, or your plasma. So, but for this one, let's first talk about the whole blood specimen. So it must be analyzed within limited time because uh, cells will lyse in whole blood, which will change the concentration of some analytes, such as your potassium, your phosphate, and your lactate dehydrogenase or your LD. Okay? Oh, ang anong mawala? Wait, diri daw ko mag-notes. Teka lang, guys. Okay. And then some cellular metabolic processes will continue, which will alter analyte concentration like glucose and lactate. Okay, so pwede siya mo lyse, pwede po siya mo continue ang mga metabolic processes which will eventually alter, analyte concentrations. So it must be analyzed within limited time only. Okay, so that's it for our whole blood specimen. Next, we have our serum. So serum is the same as plasma, except it doesn't contain clotting factors such as your fibrin. Again, guys, plasma contains all clotting factors. So this is your uncoagulated or unclotted blood plasma. So basically, guys, just a quick background. Coagulation is also known as clotting. Okay, clotting. They are the same. Okay, so it is the process by which blood changes from a liquid, okay, from a liquid to a gel form. Okay, forming it results to a blood clot. Okay, so it potentially results in hemostasis, which is the cessation of blood loss from damaged vessels, followed by repair. Okay, that's a little background of your coagulation. Basically, it stops your wound from bleeding further. Okay, so let me just uh, okay, so serum is mainly used in chemistry, lab, and serology. Okay, now next we have our coagulation reaction. Just a quick, simple background. So, guys, clotting factors, it can be defined as the substances or group of substances that help in clot formation. Okay, this is called your clotting factors. Now, we have here our fibrinogen. So, fibrinogen is a soluble protein present in blood plasma. Remember? Blood plasma from which fibrin is produced by the action of the enzyme thrombin. Now, thrombin, its primary function, okay, primary function of triggering spontaneous fibrin polymerization and the beginning of the fibrin clot. Okay, so I hope so. After forming fibrin, guys, it now makes your fibrin strands. So together with your platelets, it forms a clot. Okay, it forms a clot over the wound. So as what I've said, this clot helps to stop the wound from bleeding more. Okay, so yeah, that's it. I hope you understand, guys. It's a little bit difficult, but that's just a quick background. You will have a more intensive discussion with this one later on in your third year life. Okay, so that's it for our discussion on that one. Now let's now proceed to our specimen quality. Okay, so we have to check the quality of our specimen, guys, to know whether or not it is still viable to make use of it. Now, first, we have your quality in phlebotomy. So the role the role of the phlebotomists has never been more important. Okay, in the US, it is estimated that more than 1 billion venipunctures, or um, the process of drawing blood from your veins, are performed annually, and errors occur within this process may cause serious harm to patients, either directly or indirectly. Now we have here some critical areas. Appropriateness of the test request. We have patient and sample identification, criteria for acceptance and rejection of specimens, and lastly, communication and interpretation of results. Now, firstly, guys, appropriateness of the test request. So we have to make sure that the doctor's request is what do you call this? The doctor's request is the same as the laboratory request. Okay, so maybe the doctor will like request for a CBC for the patient, but then again, the laboratory request that the patient accidentally checked was for hepatitis. So please do take note of that one. But seldom rin siya mahitabo because most of the time, um, doctors usually prepare, or maybe nurses prepare this beforehand. Okay, and then we have our patient and sample identification. It is very important, guys, because take this situation for example. Say we have patient A who is who will be diagnosed of cancer. Okay, and then we have patient B who is, healthy. And then what if the laboratory results came back, and then when we draw blood from the two samples, okay, um instead of patient A having or will have, the diagnosis of having cancer, ang mahitabo, mapunta na noon ni patient B because of there were mislabelings that had happened between the two samples. So it's very important, guys, that you double check everything. And as what they say, the mortal sin of a medical technologist is that no label. Walang label. Okay? Dapat may label, guys, because it's 2021 already. Charot. Okay, basta mo na ang mortal sin sa medtech, no label. So make sure that all the specimens that you receive or you will get will have appropriate labels. And then we also have your criteria for acceptance. If sakto ra ba ang amount na nakuha na dugo or nasayop ang label, so we reject that. And then last is the communication and interpretation of results. So, ang pag-release sa results, guys, it matters because what if there were problems, excuse me, what if there were problems with their, what do you call this? With their names. Okay, so just be sure to double check that. Now next we have our rationale. So specimen collection is the first step in most laboratory analysis. Now it is usually, or it is always emphasized that accuracy and precision, okay, must be observed when handling patients, when writing down their names, labeling, and all that. Okay. So therefore, guys, test results are said to be as good as sample collection and handling. Okay, do you agree? 'Di ba? Kay if for example, um you made a mistake in collecting the blood. So ang mahitabo, there are factors also that will contribute to the analysis or the results of the patient. So that's why it is important to handle to collect your specimen with proper care and religiousness. Okay. Now next, phlebotomist as a laboratory ambassador, o 'di ba? Ambassador ta diring dapita. Why? Because we are always, or phlebotomists are always, the people who the patients usually see. Okay, so that is why they are expected to have or to get like one shot. I think you may have heard this, but there is like a bit of um, discrimination siguro sa mga medtechs who are not able to get blood from patient using only one syringe. So that's why some patients they usually say, "Kas alang tusok ha," or "one shot lang ha." Kay um, there's a pressure, okay? Kay kita ay sila man ang usual na makita go so good. So they are expected to, to get their job right and done. But I to be honest, I hate these kinds of people because it's there are just days guys kanang feel nimo na dili jud imuhang day in ana. So, just be nice and be kind to one another. Okay, so moro to. So that's it, the phlebotomist as your lab ambassador. And then next one, let's move on to our patient identification. This is the most important aspect in specimen collection. Okay, Kai, what if the laboratory requests for patient A is named, for example, Wong Farida, but then ang imuhang nakuhaan kay si Wong Forido, right? So that's another criteria to reject the specimen. So mukuha na pagkausab. Okay. Now the first step, okay, it is the patient identification. Now, guys, we have a lot of patients. We have a lot of types. We have lots of types of patients. Okay, nalibog na ko sa akong pag-in-English, guys. So, bear with me. But there are a lot of patients. Sorry, guys. Laban lang. Okay. So, for this one, I indicated here five types of patients. First, we have our conscious inpatients or those who are admitted in the hospital. So, how do you identify them? So you have to verbally ask their full names, verify it using the identification bracelet, which includes the first and last name, hospital number or unit number. We also have the room or bed and physician's name. We have sleeping patients. So first you have to wake them up before you go. Oh, charot. So you have to wake them up before blood collection and identify them using the same as your conscious inpatients. Now, next, we have our unconscious patients, or we can also have mentally incompetent patients. So, how do you identify these patients? You have to ask the nurse or maybe the relative that he or she has beside them and confirm it using the ID bracelet. And the next one, we have our infants and children. Now, most of the time, wala pa ka sa ilahang bedside, gahilak na sila. So what you do is to ask the nurse or also the relative, okay? And then last we have your outpatient patient, your OPD. Okay, dili wala ni sila na admit sa hospital. So you have to verbally ask their full name. You also have to ask them their date of birth and counter check with driver's license or any ID with their photo on them. Now, if the patient has an ID card or bracelet, same manner as with your inpatients. Okay. Now, take note, guys. Patient identification is the first step in blood collection. Okay. So all you have to do is let the patient state his or her name verbally, guys, and his name, his birthday, his we can also use his or her ID bracelet. So guys, you have to make sure na you will not say their names. Okay? That's an incorrect way of identifying patients. Because, for example, let's have a little situation again. When you walk inside the room, and then you go to a random patient's um, bed, and then you say Farida May Wong, and then gikan pa siya natulog, imo siyang gi-wake up, and then ingka Farida May Wong. So ang mahitabo ana, guys, munad radyo na siya mo ana radyo na siya nya, ending dili day to si Farida, lahi day to siya. So, dapat jud, guys, as much as possible, inyo jud siyang pugson na ipasulti or let him or her state good na coming from their mouths iyahang name. Because there can also be a tendency na the patient is not lying sa bed, ang relative mo'y gahigda sa bed. So, mo na no inakwaan ni mo og dugo. So, lisod na. Okay? So, it's very important. Now, we have here our pediatric patients, as what I've said. Basically, guys, what from my experience, no, with kids who throws tantrums, there were times na giluwaan ko. She spitted near sa akong face. So what you have to do, guys, how do you counter this problem? Wrap this, wait, let me just uh, pen. Wait, guys, huh? All you have to do is wrap this kid with a blanket. Okay, securely wrap this child with a blanket, covering his or her extremities, so that he or she will not be able to punch you, kick you. Okay, and then also, as much as possible, let the parent or the relative hold his or her mouth to avoid spitting on you. Okay, and then, as much as possible, grip the hand of the patient as strongly as possible, pero ayaw po nang ma-break ilahang wrists. Okay, nang igo lang jud na pagtusok nimo, dili dili nila ma-pull back ilahang kamot. Okay, so that's it for our pediatric patients. Don't forget to thank them, guys. Ha? Thank your patients for, for their time in and their permission for you to kuan ka ng pagkuha sa dugo. Then we have your adolescent patients. We have geriatric patients. So one thing you have to take note, guys, for oldies, their veins, guys, are usually uh, prominent, but take note, their veins tend to roll. Okay, they tend to roll from side to side. So what you have to do is, this is their skin, pull it like super hard. I didn't put super hard. Like pull it backwards using your thumb. Hold it using your thumb, and then make your puncture. Okay, so that the skin will tighten in that area, and it will serve as like it will also tighten the area between the vein, so that dili siya mo roll. Okay. Okay, And next, finally, guys, we have our skin puncture. So we will tackle about the skin puncture, taking note of the proper ways to do it, what are its advantages and disadvantages, and the basics of its lancet. So um, what do we use? Do we use a syringe? Do we use an animal tooth, as what we have discussed in the history of phleb? Okay, so yeah, let's tackle skin puncture one by one. I hope you are still ready to learn, guys. So let's go. Skin puncture, or it's also known as your capillary puncture. It is a finger puncture to obtain blood for routine laboratory analysis, and it is usually preferred for children, okay? Because number one, children, they tend to throw tantrums at you, mahadlok sila mulantaw og syringe. They have, or parents usually have a toxic trait na muingon sa ilahang mga kids na um like super daghan kaayo ato ang kwaon na dugo, which is incorrect, guys. Please educate your children well for the future generations, okay? Anyway, it is usually preferred for children to avoid tantrums, and then we only obtain a small amount, okay? Skin puncture, small amount of blood, okay? So it is known as your capillary or dermal puncture or skin puncture. It depends on you guys. And then the length of the lancet is 1.75 millimeters. Please take note of that one. Why 1.75, ma'am? Because it is to avoid penetrating, okay, the sharp side of the lancet. It is to avoid penetrating the bones, okay? And then the depth of the incision should be less than 2 millimeters for children and less than 2.5 for adults. Okay, 2.0 children, 2.5 for adults. Please take note. The cut should be oriented across the fingertips to generate a large drop of blood using a single deliberate motion. Okay, just one sharp jerk. Jerk sa koan nimo sa imuhang patient. Okay? So, for the next photo, this one is for newborns or usually mga children, pero we usually incorporate this one sa mga newborns, okay? And this is the finger. Now, as you can see, the puncture should be across fingerprints so that we will generate a large drop of blood. And then for the children, we choose the lateral sides. Okay? Okay, go. Now, next, we have our preferred sites. So, what is the most preferred sites? Now, as what I've said, lateral plantar heel surface, lateral plantar heel surface for newborns and infants. We have the palmar surface of the non-dominant fingers. Now we have our third and fourth finger, which is fingers which are the most common. So mauni siya. So ngano man, because this two here, ang anong non-dominant, because basically guys, it's to avoid callus, okay, kanang it is thickened skin bitaw. So sa ato amang kong fingertips sa right sa dominant hand nato, it's usually callus, which makes it harder to puncture. And then we use the third and fourth fingers because we don't usually what do you call this? we don't usually have a lot of callus here in this area. And then we have our earlobes. It is the least site because the earlobes, okay, they don't usually bleed that much. Okay. Next, we have our sites to avoid. So as this is for guitar, for guitarists. Okay. Now, inflamed and pallor areas, we have our cold or cyanotic areas, congested and edematous areas, scarred and heavily callous areas, which is a little bit harder to puncture. Okay. Now, okay. Now, next, we have your procedures for your skin puncture. So I hope you've watched the video that I have attached in the classroom. So this is the procedure, okay, step by step. Number one is to identify the patient properly. Choose an appropriate site for collection, and then after picking your third or fourth finger, clean it with 70% alcohol. Okay, it doesn't matter if concentric circles, basta use friction when cleaning the area. Now hold finger between your index finger and thumb. Puncture the finger using a quick, smooth motion. Okay? Diri na area, dili ka ni. Wipe away the first drop of blood. Why man? Because the first drop of blood, it is usually contaminated with uh, tissues, okay, with bodily tissues and excess alcohol. Okay? So take note guys, when you clean the site, allow it to air dry. Do not fan it, do not blow on it kay mo contaminate na pod. So air dry lang usa before you make the puncture. And then you collect the blood sample. After that, apply pressure to puncture site using cotton, and of course label the specimen in sight of patient. So dapat makakita ang patient. Okay, so here are some pictures. So first, you have to wipe and then make the cut. Let it air dry, make the cut, and then wipe away the first drop of blood because again, it is it is contaminated with bodily fluids and excess alcohol. And then collect your drop of blood. After that, put pressure on the cut using the cotton. After that, label and thank the patient for their cooperation. Okay, now next, let's move on to the materials needed for our skin puncture. Okay, so we have here our alcohol, gauze, and bandages. So CLSI recommends using 70% isopropyl alcohol to clean, okay, the capillary bed of the skin with a lancet or other sharp device. Gauze or cotton balls are used to wipe away the first drop of blood to eliminate alcohol residue. Here's the answer, and excess tissue fluids. And bandages are used to cover the site after collection. Okay. Now next we have our lancets. We have different types of lancets. So lancets are sterile, disposable, sharp instruments used for capillary puncture. So what we have in MedTech or ICLS, we usually incorporate this one, but we also have these two lancets here. They can also be used. Okay, so as you can see, it's just a small, what do you call this? A small needle. Okay. Now, I think for me, this is optional, your warming devices. So, warming the sites increases blood flow up to 7 times and especially important when performing heel sticks. Okay, so water temperature must not exceed 42 degrees Celsius or it may burn or scald the patient. But what I usually do, guys, is I usually hold the hand of the patient. Okay, oh my gosh. I usually hold the hand of the patient and I massage their hand, you know. I use I usually massage the fingertips to allow blood flow to happen. Okay, so sa mga naay if guwapo ang kuan or if guwapa ang patient, na mo'y chance guys para maka-chancing charot, 'di ba? Teaching you how to make landi. Charot. Don't kuan guys. Ay mugsaba. Now next we have our sealant. So this is for our capillary instrument. Now, sealants are clay-like substances used to seal one end of your microhematocrit tubes. So, as please take note, the clay plug should be 4 to 6 millimeters long. So we have here our uh, we have here our microhematocrit tubes. So more or less in ani kadaghan ang clay or ang sealant. Okay. Now what we use in medtech is we have this clay and we also incorporate wax. Okay, candila, candles para dual purpose. Okay. Now next, mo ni siya guys. So we usually seal sa band, okay, with band mo pasulod sa blood. This is where you usually collect the blood. And then without the seal, without the band, dito mo seal. So usually guys, ang microhematocrit tube, they are this na siya band. So this is where you collect the blood and then naa siya one end diri na walay band. So diri mo seal gamit ang sealants. Okay? So I hope that's clear. And then next up, we have our indications for capillary puncture. So can be done if small amount of blood is required. Okay, that's also a good chance for infants. Okay, because uh, infant venipuncture is difficult and can damage veins. Okay, they can also be injured by restraining method using the venipuncture. And also infants have small amount of blood. So usually when we remove 10%, it can lead to anemia and threaten the life of the patient. So yeah, please take note guys. If infants, please use skin puncture instead of venipuncture. Okay, and then we also use capillary puncture if there are no accessible veins, if available veins are fragile, if blood is to be obtained for point of care testing procedures such as glucose monitoring, and capillary blood is preferred for newborn screening, okay, because of the reasons I have mentioned a little while ago. Now, next, we have our advantages of skin puncture. So, we have three advantages. It is accessible to the operator, it is easy to manipulate, and it is ideal for peripheral blood smears. Okay? And then for the disadvantages, we also have three. It has less amount of blood. Additional and repeated tests cannot be done, okay, because gamay ra ang volume sa blood. So, di jud mo siya ma-repeat testing. And blood obtained has tendencies to hemolyze easily. Okay. Now, next, we have our specimen quality. So, capillary blood obtained through skin puncture transferred to an anticoagulated capillary tube, so which is your heparin. Heparin is the anticoagulant. Okay, this is used sa red band. Okay, whereas EDTA anticoagulated blood transferred to a non-anticoagulated capillary tube, color niya is blue. Okay? So we have red and blue. Heparin ang anticoagulant sa red. Now, capillary tubes must be two-thirds to three-fourths full, and you have to avoid air bubbles and spaces between the tubes, between the blood. Sealed, you have to seal first with a clay sealant, as what I've said a little while ago, and then paraffin or your wax. So first, ang clay sealant, lastly, imong paraffin. Okay? So we have red and blue and then your sealants. So again, sa naa mo na band, dito nimo i-enter ang blood. Okay? Now, next up, we have our proper labeling. So you have to label patient's full name, age, DOB, time and date of collection, and your initials. Okay, then let's tackle arterial puncture. So usually, guys, in venipuncture, if the phlebotomist accidentally punctures an artery instead of a vein, what you have to do is you have to apply pressure on the area and report to supervisor. Now, take note, guys, arterial puncture, we medtechs, we don't usually perform this, but this is just a good to know fact for all of you. Okay, now arterial puncture, of course, we the specimen for that blood obtained is from your arteries. It is used for blood gas analysis and pH measurement. If acidic or maybe alkalinic imuhang blood, arterial puncture is the way to go. So sites, we have your radial, brachial, and your femoral artery. Now, blood sample is collected without your tourniquet because it already has pressure coming from the pumping of your heart. So, if butangan pa nimo siya hikot dira, kuyapan diritso imuhang koan pasyente. Okay? So specimen should be placed in ice, water, or other coolant that will maintain a temperature of 1 to 5 degrees Celsius to minimize your cells their consumption of oxygen. Okay, so just that arterial puncture is just a good to know fact, and when a person accidentally punctures it, you have to apply pressure to the area and report to the supervisor. Okay, so we have here our sources. Thank you so much, Sir Cinco, for this PowerPoint. And that's it for this lecture, guys. I hope you learned something new in our lecture. I know it is a little bit long, but please do bear with me. And if you have any questions, feel free to chat me via Messenger. And as always, guys, take care of yourself. Have a great day ahead. And I hope to see you in the next video.